You unlock the door to a seasonal cabin or a backyard shed that hasn't been opened in months. The air inside is stale. Over in the corner, you spot a small scattering of mouse droppings. Your first instinct is usually to grab a broom or plug in a shop vacuum to clear the floor. In this specific environment, that is the most dangerous choice you can make. Sweeping kicks up a dense cloud of microscopic dust. If those droppings belong to a rodent carrying hantavirus, you are now surrounded by aerosolized viral particles originating directly from their dried urine and feces. The rodents that carry this pathogen show zero signs of illness, but for a human who inhales that contaminated dust, the mortality rate can approach 40%, depending on the specific viral strain. Catching the infection early is incredibly difficult because of a clinical blind spot. The initial symptoms, fatigue, fever, and heavy muscle aches in the thighs and back, perfectly mimic the seasonal flu, which often delays patients from seeking urgent medical care. The danger of hantavirus is its ability to hide an incredibly lethal infection inside the dust of routine household chores. This viral family does not attack everyone in the same way. The pathogen operates differently, based entirely on geography, splitting into two distinct clinical syndromes. This map illustrates the geographical divide, splitting the world into two primary viral territories, the Americas and Europe and Asia. Focusing on the Americas, strains like the Sin nombre virus carried by the deer mouse trigger hantavirus pulmonary syndrome, or HPS. When inhaled, the virus attacks lung capillaries. Blood vessels leak, rapidly flooding air sacs with fluid, effectively drowning patients. Panning to Europe and Asia, the threat changes. Here, strains carried by rats and voles trigger hemorrhagic fever with renal syndrome, or HFRS. Instead of the lungs, HFRS targets the kidneys. It leads to sudden internal bleeding, severe drops in blood pressure, and acute kidney failure. Regardless of which hemisphere you are in, hantavirus weaponizes the human vascular system to trigger catastrophic organ failure. There is one terrifying exception within the hantavirus family, found primarily in South America, the Andes virus. It is the only strain known to cross the barrier into